Bismillahirrahmanirrahim. Today, our topic is blood physiology. फिजियोलॉजी सब्जेक्ट के हवाले से जो मेन टेक्स्ट बुक चलती है वो गाइटन एंड हॉल है। बड़ी सी मोटी सी किताब और यह आजकल 14वां एडिशन है, इसका 14th एडिशन अवेलेबल है इन द मार्केट। ओके, और फर्स्ट ईयर में फिजियोलॉजी के हवाले से इस सारी मोटी किताब को नहीं कवर करना, इसमें से चंद यूनिट हैं जो हमने करने हैं। काइंडली आप कागज़ पेंसिल ले लें ताकि मैं वो टोटल कोर्स जो है फिजियोलॉजी का वो मैं आपको लिखवा दूँ। इसमें कंटेंट्स में आप देखेंगे तो फर्स्ट ऑफ ऑल द यूनिट 1 है। It is relating to the introduction of physiology, the cell and general physiology. Unit 2, membrane physiology, nerve and muscle. इसके अंदर जो चैप्टर्स हैं वो वाले सारे हैं। Unit 3, heart. Unit 4, circulation. उसके बाद यूनिट 6, blood cells, immunity and blood coagulation. And unit 7 about respiration. ये 6 यूनिट बनते हैं ये। And the last from the unit 12, not all the unit but only chapter number 74 about body temperature regulation and fever. So this is the course of physiology subject for you in the first year. Remaining units and chapters, they will be in second year. कल आपने पहला यूनिट आपने स्टार्ट किया जिसमें चैप्टर 1 हो गया। ओके, अब इसके और ये मुख्तलिफ चैप्टर्स मुख्तलिफ ये किए जाएंगे और इसमें आज यूनिट 6 है। इट इज़ अबाउट द ब्लड सेल्स and anemia and polycythemia, and the chapter number is 33 about it. Blood, definitely you have come across maybe at certain times and occasions when you have seen definitely blood. This is a blood bag, donated blood in it, and these are the white bags also. Maybe in these the different constituents of the blood like platelets and white blood cells, they may be inside. Okay, this is another slide for blood showing the red blood cell and white blood. Red blood cells are biconcave shape like a donut, and others white blood cells and different types of white blood cells, and occasionally there are the fragments, small fragments of the megakaryocytes. These are the platelets. Yes, what comes into the mind when we say blood? If we have to define the blood, how can we say? You you think about it. Blood is the fluid. It also comes in the group of connective tissues. Blood is the fluid which circulates in the whole body by a special circulatory system, and that provides the requirements to all the cells of the body. Requirement, nutrition, oxygen. It is the requirement of all the cells, all the cells of the body, from brain to and the brain, heart, abdominal organs, to the toes of the feet. Regarding volume of blood, total blood volume makes up about 7%, that is 6 to 8% of the body's weight. Accordingly, a 70 kilogram person, 70 kilogram of weight will have 5 to 6 liters of blood and about 70 milliliter per kilogram of body weight. Normally in the circulatory system, that is heart and blood vessels, circulatory system, heart and the blood vessels, सारा ब्लड इन्हीं में मौजूद नहीं है 5 to 6 liters. It will be in different organs. Circulating blood volume will be lesser than total blood volume because some amount of blood will be deposited in organs like liver and spleen. Okay. One thing is more that these informations of this chapter today, these are not included in this chapter 33, but it is in the syllabus of UHS. So we have to take these lines, our knowledge, from some other books. Recommended books, are the Ganong's book. Ganong is also a physiologist, and Guyton. ब्लड कंपोजिशन के लिहाज से, if we take, for example, if we take blood in a test tube, small test tube, and adding anticoagulants into it so that it may not clot or coagulate, when we add anticoagulant, then it remains in the fluid form. And when this test tube is centrifuged for 4 to 5 minutes, this shape will be there. Blood is filled up to this level, but after some times we will see that in the base it is red, and these are the red blood cells. It amounts almost 45% of the whole this blood, and the upper column from here to here, it is a clear plasma having no solids, but it contains many other things like proteins, ions, chemicals, glucose, nutrition, and many other things. And in between, there is a Buffy code, which accounts less than 1%, and it is of platelets and white blood cells. So, platelets and white blood cells, it accounts less than 1% of the total blood volume in the test tube. Almost 55% is the plasma and 45% is of whole blood. And और यही प्लाज्मा को ही हम हेमाटोक्रिट भी कहते हैं. That is the concentration of red blood cells or packed cell volume in the blood. In another slide, sample of whole blood, it consists of plasma 45%. It is range 46 to 63%. Only one figure is not considered. That is average. Say if it is 40%, it is a 45%, but the range is 46 to 63%. Like if you see the body temperature, how much it is the body temperature, we all say 98.6 Fahrenheit. Okay, but there is a normal range from 97 to 1999 or 98.8. It is a normal range and it is normal. And the remaining are the formed elements. It is a 45. It is a 55%, and this is 45% almost average. And these form elements, they constitutes platelets, white blood cells, and red blood cells. Among these formed elements, only 0.1% are platelets, these, and the white blood cells, and the remaining 99.9% they are red blood cells. 99.9% of the red blood cells of the formed elements, because and it looks red due to these red blood cells and due to hemoglobin in the red cells. So it's look red, and depending upon the concentration of hemoglobin and the number of red blood cells, the color of the skin or conjunctiva will be according to their concentration. Okay, and white blood cells, they are 5 different types: neutrophils, eosinophils, basophils, lymphocytes, and monocytes. In the plasma, in the cells, when there are granules, when there are granules in the cytoplasm, they will be called granulocytes. Okay, for example, these 3 ones are the granulocytes, and the lymphocytes, and their side, it has big sized nucleus. These are the nuclei. Is a big sized nucleus, and around outside it is a thin layer of cytoplasm which is clear, having no granules, so it is a granulocyte. Monocyte, the shape of the nucleus is like a kidney or horseshoe. Blood film, it is a peripheral blood film made in the laboratory. When we perform the practical of blood film, a drop of blood is taken on the slide and spreaded out and stained with some stain. It looks like this. These are the numerous red colors. They are red blood cells, and the other big ones are the leukocytes, white blood cells. It is a neutrophil having three or four nuclei, bilobe. It is two to three nuclei. This is having not this is having a nucleus. Okay, that involves the cytology of peripheral blood cells smeared on a slide. Blood composition, very simple. Cellular composition or cellular components, and other the liquid component, that is a plasma. Cellular components, it contains red blood cells, also called erythrocytes, white blood cells, also called leukocytes, platelets, they are also called thrombocytes, and the clear fluid which we see on above the cell components, there is a plasma, and in plasma it constitutes about 92% of water, 92% of water, ions, plasma proteins, and in plasma proteins, these major plasma proteins are albumin, globulin, fibrinogen, and prothrombin. They have different functions. Albumin का अपना function, globulin के अपने functions, fibrinogen के अपने, और prothrombin के अपने. And it has plasma has the same ionic composition as interstitial fluid. Interstitial fluid, extracellular fluid, outside the cells. Once again, this for understanding, it is another slide taking a drop of blood, 45% formed elements, 55% almost plasma, and this plasma further constitutes, as we have said, electrolytes, water, proteins की मिकदार 7%, water 92%, almost both these are 99%, and the remaining are the electrolytes, that is ions, cations and anions, waste products, nutrients, vitamins, hormones, chemicals, and also gases. Gases, they are nitrogen, oxygen, carbon dioxide, and among proteins, these three proteins are there, and in the formed elements, which is about 45% of the blood, at 95%, 95.1%, or more than 95%, it is red blood cells. Okay. Along red blood cells, platelets and white blood cells. And the white blood cells, they are neutrophils, eosinophils, basophils, monocytes, and lymphocytes. And these 5 types of the cells, they have different functions. Hematocrit. And if a portion of blood is centrifuged or allowed to stand for a sufficient long time by adding some anticoagulant. If anticoagulant is not added, it will be clotted, because the clotting factors and prothrombin and fibrinogen is present in the blood. So for inactivating them, anticoagulant is added. For example, anticoagulant is EDTA, and calcium citrate, etc. Although after standing for some time, it will be found that the blood cells will settle towards the bottom of the test tube, while the plasma remains on top. By this mean, the percentage of blood cells, how much is the blood cells? Percentage of blood cells in whole blood can be calculated or determined. And this figure having you formed elements, it is a buffy coat of leukocytes, thrombocytes, remaining are the red cells, the upper portion of crystal clear plasma. So the hematocrit is taken about the red blood cells, okay, because their number is much more. So it is the number of the leukocytes and thrombocytes. It does not constitute uh, in the hematocrit. Hematocrit, also known as packed cell volume, or erythrocyte red cells, erythrocytes volume fraction. It is the volume percentage of red blood cells in the blood. कि इस सारे ब्लड में वहाँ टॉप से लेकर नीचे तक रेड ब्लड सेल की कंसंट्रेशन हाउ मच. It is normally about 40 to 48% for men and 36 to 42% for women. Blood and hemoglobin, they are slightly less in women and as compared to men. Once again, it is another version of the definition of hematocrit. Hematocrit is the ratio of the volume of red cells to the volume of the whole blood. सारे ब्लड में से उसकी कितनी रेशियो है? वेरी सिंपल टू से, एंड इट इज हेमेटोक्रिट. नाउ द ब्लड प्लाज्मा जो कि 55% ऊपर है, दिस वन इज इट. व्हाट अबाउट द प्लाज्मा? इसमें क्या कुछ है ये हम देख लें पहले. इसके अंदर क्या है? इस प्लाज्मा जो क्लियर है 55%. Composition of this is water and dry substances. There is a 90 to 92% of water, and the remaining are the dry substances. And what are the dry substances? They include mainly proteins, 6 to 8% of the plasma, and inorganic minerals and organic components. Inorganic, organic, along with proteins. The main inorganic mineral components, they are in the group of the cations: sodium, potassium, calcium, and magnesium. And in the subgroup of anions, chlorides, phosphates, and bicarbonates, they are present in different compositions, different ratio having in the plasma or blood. Plasma proteins. Plasma also contains proteins. Among these proteins, maximum amount is of albumin, 65 to 85 gram per liter. It is meant for purpose of albumin is transportation of the chemicals and hormones and different other constituents, and their molecular weight is 68,000. And the second function of albumin is regulation of oncotic pressure. Oncotic pressure is just like osmotic pressure, but when it will be oncotic, that means it is the pressure exerted by the plasma proteins, and mainly protein is albumin and then globulin. Okay, so the oncotic pressure means the pressure, osmotic pressure exerted by the big particles like proteins and albumin. They also it also regulates the pH of the blood. So it is a function of the albumin. A second one is the globulin. It is almost 28 grams per liter, and subgroups of globulin are alpha globulin, beta globulin, and gamma globulin. Alpha globulins, it is also meant for the transportation of the hormones or chemicals, and their molecular weight is 90 to 100 and to 1300 thousands. Beta globulins, it is also for the transportation of the hormones, and the gamma globulins. Gamma globulins, they are meant for the defense of the body, like immunoglobulins. Immunoglobulins, they are the gamma globulins. ये जो आजकल जो एंटीबॉडीज करवाने की जो ज़रूरत पड़ रही है कोविड-19 के हवाले से, कि इस वायरस के अगेंस्ट एंटीबॉडीज़ जो बन जाती हैं, वो immunoglobulin G, immunoglobulin M, are many others. Third protein is the fibrinogen. It is 3 gram per liter, and it is for the blood clotting or hemostasis, not homeostasis. Homeostasis is a different word. It is a hemostasis. Hem means blood, stasis matlab to stop the blood. And prothrombin, it is 150 to 400 milligram. They were in the grams, and it is for the milligrams per liter, and it is also for blood clotting. So 4 types of proteins mainly are present in the plasma, but apart from these, many other types of proteins are present in the plasma or blood. Functions of plasma proteins, their ratio, about their synthesis and the separation of these proteins. They can be separated by electrophoresis. Okay. Their main purpose is maintenance of the colloidal osmotic pressure. जैसे पहले मैंने कहा colloidal या oncotic pressure, ये blood का pressure maintain करने के लिए, so that they remain in the closed circulatory system in the vessels. It should not be leaked outside the vessels or into the cellular into the intracellular spaces. So maintenance of colloidal osmotic pressure, which is about 25 millimeter of mercury, and among this pressure, albumin का हिस्सा 80% के पास है, because their size is greater, their weight is more. It constitutes for 80% of the colloidal osmotic pressure. Second function, maintenance of this pressure is essential to regulate fluid volume in the intravascular compartment and interstitial spaces, and to maintain the capillary dynamics also. Capillary और venules का जो dynamics है कि उसका exchange हो के vessel system से circulatory system से बाहर जाना और वहाँ. So the first function of the plasma protein is maintenance of colloidal osmotic pressure, and number 2, protective function. Protective function that is exhibited by the immunoglobulins, gamma globulins. Third, these also help for coagulation of blood, and they also regulate the pH of blood and and transport functions and maintenance of the viscosity of blood. Also, it was a function of the plasma proteins. L- the lipids and carbohydrates in the plasma. Major plasma carbohydrate is glucose. The concentration of glucose is 3.3 to 5.5 millimoles per liter. The major plasma and the major plasma lipids are cholesterol and triglycerides. Major portion of carbohydrate is glucose, and the major lipids are cholesterol and triglycerides. And plasma normally contains varying amounts of hormones, enzymes, pigments, vitamins, and the composition of plasma varies with the body's activity and different physiological states. The composition of plasma varies with the body's activity. अगर इंसान वर्जिश कर रहा है, बहुत सख्त काम कर रहा है, तो then इनकी जो नॉर्मल वेरिएशन है, नॉर्मल अमाउंट है, that can vary और डिफरेंट फिजियोलॉजिकल स्टेट्स. जैसे इंसान बीमार है, सोया हुआ है, दौड़ रहा है, काम कर रहा है, तो तो उसमें इनकी कंपोजिशन में वेरी. सीरम, सीरम कैसे कहते हैं? When fibrinogen is removed from plasma as a result of coagulation, and such plasma without fibrinogen is called serum. प्लाज्मा में से फिब्रिनोजन निकाल दें तो वो उसे सीरम कहते हैं. या पहले तो हमने ट्यूब में एंटीकोगुलेंट डाला. ओके, अब उस ट्यूब को में एंटीकोगुलेंट अगर ना डालें तो नीचे ब्लड सेल्स और ब्लड क्लॉट हो जाएगा, और फिर उसमें से आफ्टर सम टाइम अगर उसे कंप्रेस किया जाए तो उसमें से जो स्क्वीज होकर पानी निकलेगा, या जैसे कहें जैसे पहले हम कह रहे थे कि प्लाज्मा, अब वो उस वाले पानी को हम सीरम कहेंगे, बिकॉज फिब्रिनोजन हैज़ बीन यूटिलाइज्ड in the process of clotting. So serum is without fibrinogen. Now the physicochemical constants of blood. इसका अपना ऑस्मोटिक प्रेशर है, पानी है, हर जो पानी जो 92% है उसकी वजह से ऑस्मोटिक प्रेशर है, बाकी प्रोटीन्स की वजह से ऑनकोटिक प्रेशर है, उसकी ब्लड पीएच है, इसकी फिजिकोकेमिकल ये कांस्टेंट्स हैं कि जो कितनी रहनी चाहिए, विस्कोसिटी है, क्यू है, स्पेसिफिक ग्रेविटी ऑफ दिस वन, एंड ऑल्सो एरिथ्रोसाइट सेडिमेंटेशन रेट. अगर इनको एक ट्यूब में, बारीक सी ट्यूब में डाल के खड़ा कर दिया जाए तो जो ESRs हैं, जो रेड सेल्स हैं, दे विल सेडिमेंट एट द बॉटम. Okay, pH of blood. What is pH? Simply, it is the concentration of hydrogen ions. Concentration of hydrogen ions. More the number of hydrogen ions, lesser will be pH. If the hydrogen ions are comparatively less, so it will be said the pH is more. But here, how it is defined, pH is a measure of the acidity or basicity of an aqueous solution. This acidity is due to the hydrogen ion concentration. अगर hydrogen ion concentration ज़्यादा है तो that liquid or fluid will be acid. अगर वो कम है, जो alkaline things हैं उनकी वजह से, वो उनकी एसिडिटी कम होगी और वो बेसिसिटी की तरफ पीएच उसकी जाएगी. Another definition, it is a negative decimal logarithm of hydrogen ion concentration. And what is the normal pH of the blood? Then once again it is 7.4, but the 7.4, but the normal range, the arterial normal range. Also arterial blood की pH कितनी है? That is 7.45, okay, and 7.35 it is of the venous blood. Definitely venous blood में कार्बन डाइऑक्साइड ज़्यादा होती है, इसलिए इसकी, और that is more more acidic. If pH is less than 7.3, then the condition is called acidosis. And when the pH is more than 7.5, it is alkalosis. These are the pH values of some common substances. You can see it. Normal pH and neutral pH 7 is of distilled water. 7 pH is neutral. It is of distilled water. और ऐसे ब्लड की pH 7.4 सी वाटर की उससे बढ़ती जाएगी. बेकिंग सोडा, अमोनिया सोल्यूशन, ब्लीचेस, सब इस लिहाज से इनकी pH ज़्यादा होती जाएगी. इनकी ज़्यादा होती जाएगी और they are going towards more alkaline conditions. And if the number of the hydrogen ions they increase, so it will be increased number of hydrogen ions here the decreased number of hydrogen ions, and here the increased number of hydrogen ions. For example, so the pH will be less. Milk, saliva, इनकी pH, black coffee, grapefruit juice, soda, tomato juice, lemon juice, pH 2. Battery acid, hydrochloric acid, इनकी pH 0. It's the maximum number of hydrogen ion pH. And once again, you think about the pH of acid of our stomach. It is almost near lemon juice, which is helpful for digestion of food what we take. And this is maintained by excretion of carbon dioxide by the lungs. दो तरीकों से, लंग्स और किडनीज की वजह से. लंग्स कार्बन डाइऑक्साइड को बाहर निकाल देंगे और जो एक्सक्रीशन और जो किडनीज हैं वो हाइड्रोजन आयंस को बाहर निकालेंगे. And it is maintained by the action of the buffer system. This pH is maintained by the action of the buffer system, and the different buffer systems are present in the body. There is the carbonate buffer system, phosphate buffer system, proteins, and among proteins is a hemoglobin. Yes, one it is another definition of pH of blood, a solution which resists changes in pH when acid or alkali is added to it. Viscosity of blood. Blood viscosity is described as the thickness and stickiness of blood, and it is a measure of the resistance of blood to flow. ये कैसे measure की जाती है, कैसे अंदाज़ा किया जाता है? Viscosity of blood is 3 times more than that of water, based on time taken for the flow of both in a tube. अगर एक ट्यूब में ब्लड और दूसरी ट्यूब में पानी डाला जाए और उनको एक एंगल से गिराया जाए तो पानी के निस्बत 3 टाइम जो टाइम पानी को बहने में लगेगा उससे 3 गुना टाइम ज़्यादा ब्लड को बहने में लगेगा. And this viscosity, it is thicker, and it is thicker due to red blood cells, RBCs, red blood cells, and plasma proteins. Similarly, specific gravity of blood, it is the ratio of the density of a substance. It's the ratio of a density of a substance to the density of a reference substance. एक reference substance है उसको